You're sitting in the testing center. You've studied. You know your material. Then a question pops up on the screen. And it's not asking you to define a term. It's asking you what you do. Two answers look right, maybe three. And for a second, your mind goes blank. That moment, right there, is where a lot of CNA students lose points they should have kept. Not because they didn't study, because nobody ever taught them what to do the moment they get stuck. I'm Damon Davis, psychiatric registered nurse with nearly 4 decades of clinical experience at a major New York hospital, healthcare educator, and founder of Kingdom Guardian. And today, I'm giving you the exact 4-question framework I teach every student for the moment you don't know the answer. Because guessing is not a strategy, reasoning is. Stick with me. This one might save your test. Here's something most CNA study guides never tell you. The hardest questions on the written test are not vocabulary questions. They are scenario questions. The exam describes a situation, a patient, a moment, a decision, and asks you to pick the best action. Not the only correct action, the best one. That's a different skill than memorizing facts. You can know your content areas cold, physical care skills, basic nursing skills, all of it, and still freeze on a scenario question. Because scenario questions test judgment, not recall. And when students freeze, they do one of two things. They guess based on gut feeling, or they pick whichever answer sounds the most caring, even if it's not the safest or the most correct procedure. Both of those are guesses, dressed up to look like decisions. You need something better than a feeling. You need a process. So here's the framework. I call it the 4-step framework, and it's adapted straight from how real nurses are trained to think under pressure. The same clinical reasoning used in nursing exams at every level above CNA. When you hit a question you're not sure about, don't guess. Run it through these 4 questions in order. Step 1. Which answer keeps the patient safest? Safety comes first, always. If one answer protects the patient from harm and another doesn't, safety wins, even if the other option seems more polite or more efficient. Step 2. Which answer respects the patient's rights and dignity? If safety doesn't settle it, this does. Privacy, consent, how the patient is treated as a person, that's the next filter. Step 3. Which answer follows proper procedure instead of your personal judgment? This is the one that trips people up. The test is not asking what you would personally do. It's asking what the correct procedure says to do. Set your instinct aside and follow the standard. Step 4. Does this situation require reporting to a nurse or supervisor? A lot of scenario questions are secretly testing whether you know your scope, whether you know when a decision is above your role. Run through all 4 in order, and if you're still stuck at the end, choose the answer that protects the patient every single time. Let's use it. Here's a scenario like one you might actually see. You're assisting a patient with bathing, and the patient asks you not to tell their family they've been having trouble remembering things. What do? Step 1. Safety. Is there an immediate safety issue? Not directly, so we keep going. Step 2. Rights and dignity. The patient has a right to privacy about their own information, and you respect that in the moment. Step 3. Procedure over personal judgment. Even though you want to honor the patient's request, procedure says a change like this gets reported through the proper channel, not kept as a personal secret between you and the patient. Step 4. Does this require reporting? Yes. This is exactly the kind of change in condition that gets reported to the nurse, not decided by you alone. See how that works? You didn't guess. You reasoned through it. If you want to practice this on real CNA-style questions, 25 of them, with a full answer key that shows you exactly how to reason through each one, that's inside the $7 Fast-Track Prep Guide. Links in the description. DamonCDavis.system.io/9F979517. Now let's talk about the mistake that undoes this framework before you even use it. Here's the mistake that undoes all of this. Answering with your gut instead of the framework. A lot of CNA students have good instincts. They're caring people. That's usually why they're in healthcare in the first place. But good instincts and correct test answers are not always the same thing. If a question feels obvious, that's exactly when you should still run it through the 4 steps, not skip them. The test is written to make the wrong but comforting answer look tempting. That's not a trick to punish you. It's checking whether you can follow procedure under pressure, the same way you'll need to on the actual floor. So here's your new habit. The moment you feel yourself about to answer from your gut, stop. Ask which answer is safest. then dignity, then procedure, then reporting. Every time you're unsure, even a little unsure, run the 4 steps. Don't save it for the hard questions. Practice it on the easy ones, too. Let's lock this in. 4 questions every time you're not sure. Is the patient safe? Are their rights and dignity respected? Am I following procedure instead of my own judgment? Does this need to be reported? Safety, dignity, procedure, reporting. Say it with me if you have to. Write it on an index card if that helps. This is the exact order real nurses are trained to think in when a decision isn't obvious, and it works just as well on a multiple choice screen as it does at a patient's bedside. You already have the clinical knowledge. This just gives that knowledge a place to go when the question doesn't hand you an easy answer. I put this same framework word for word in my free guide, 4 things every CNA student must know before test day, along with 3 more strategies for the skills portion of your exam. The foot of the bed pause, the are you sure proctor strategy, and the 3-point setup you check before you even touch the patient. All 4 strategies, 1 free download. Link is in the description and pinned in the comments. damoncdavis.system.io/CNA-free-guide. Grab it. And if you want to actually drill this reasoning on real practice questions, the $7 Fast-Track Prep guide has 25 of them waiting for you. If this video helped you, subscribe. There's more coming on exactly how this test is built and how to walk in ready for it. I'm Damon Davis. God bless you. Now go study.